Hello warriors, welcome to this episode of Stand for AS videos. Today let us have a look at tablet sulfasalazine, tablet Saaz or tablet Sazo that you must be taking for your ankylosing spondylitis or other types of arthritis is chemically known as sulfasalazine. Let us have a look at this medication in detail today, its dose, its effects, its side effects and other things all related to this medicine. Let us have a look at this.
Sulfasalazine is available in the market in the following trade names: tablet Saaz, tablet Sazo, tablet Salazar, and tablet Sulcis. It is available in two strengths, 500 mg and 1000 mg or 1 gram. As far as the dose is concerned, in an adult, one can take up to 50 milligrams per kg body weight. That would mean for a person weighing 50 kg, he can take up to 2.5 grams per day. Which arthritis is it useful? It is definitely useful in rheumatoid arthritis, psoriatic arthritis, and inflammatory bowel disease related arthritis. Inflammatory bowel disease related arthritis would mean arthritis in someone who is suffering from Crohn's disease or ulcerative colitis. As far as ankylosing spondylitis or seronegative spondyloarthritis is concerned, ankylosing spondylitis or seronegative spondyloarthritis, whenever we look at one, axial involvement and peripheral involvement. Axial involvement would mean inflammation restricted to sacroiliac joints and joints of the vertebrae, whereas peripheral spondyloarthritis would mean inflammation that is also involving peripheral joints like knee, ankle, foot, hand joints. As far as peripheral joint inflammation in this condition is concerned, sulfasalazine is definitely useful. When it comes to pure axial disease, which would mean inflammation involving only the sacroiliac joints and the vertebral joints, there is a difference of opinion among rheumatologists. There is a group of rheumatologists who feel that sulfasalazine is not useful when it comes to pure axial arthritis. This is so because there are not many studies of sulfasalazine which have shown it to be useful in pure axial disease, whereas there is also a second group of rheumatologists who have good experience with sulfasalazine and they do feel that it does have effect in the axial disease as well. Sulfasalazine is not an analgesic, it is a disease modifying anti-rheumatic drug. What would this mean? It is not a medicine that just cuts down on the pain but actually heals the arthritis from within. It is a slow acting medicine and takes anywhere between 4 to 6 weeks for its effect. So if you have active joint pain and if you take sulfasalazine tablet right now, do not expect the pain to go down immediately as the case in when you take a painkiller, but it would act slowly and expect its effect to be seen in 4 to 6 weeks. Sulfasalazine is available as a delayed release tablet. It has a coating on it to prevent its disintegration in the stomach to avoid irritation and acidity. That's why it is also known as gastro-resistant. So if you look at the packets, there are two types of packets that you will get to see. One is sulfasalazine delayed release tablet, and the second one is sulfasalazine gastro-resistant tablet. Both of them are of the same medicine, so do not get confused when you see these two packets. One of the important things to understand here is you cannot cut the tablet into two and take it as half the dose, because that way you're going to disturb the coating, the special coating that is there on the tablet, and then you can end up with acidity. What is the difference between Saaz and Saaz DS? This is a common confusion that exists for many warriors. Saaz is sulfasalazine 500 mg and Saaz DS stands for double strength. So it is a 1 gram tablet or 1000 mg tablet. What are side effects of sulfasalazine? One of the most common side effects is allergy. Sulfasalazine belongs to sulfa group of medicines. So if someone is allergic to sulfa, then one can end up with allergy when sulfasalazine is taken. That's also the reason why this medicine is gradually increased when it is taken for the first time. For example, 500 mg is given for once a day for 3 days, then twice a day for 3 days, then thrice a day for 3 days, and then the dose is escalated further. This is done so that if somebody has allergy, we have sufficient time to see the allergy effect and then the medicine can be stopped. If you are allergic to sulfa, please inform your rheumatologist accordingly when the drug is being started. If you end up with allergy related to sulfasalazine, you may have rash, itching, or you may have blisters on the lips or genital areas. If anything of this sort happens, inform your rheumatologist immediately and stop sulfasalazine. Secondly, it can cause nausea, gastritis, acidity. The delayed release tablet has a coating wherein it doesn't get disintegrated in the stomach and cause acidity. So these newer tablets have lesser chance of causing acidity. Thirdly, something that many of you who are taking sulfasalazine must have observed, the urine turns yellow or reddish on taking sulfasalazine. This is not a side effect of the medicine per se, but it is just discoloration of the urine because sulfasalazine gets converted into a compound in the body which is colored, which gets passed through the urine. One of the important side effects of sulfasalazine is oligospermia. Oligospermia is a scientific term for drop in sperm count. So, a few warriors on taking sulfasalazine can experience a reduction in the sperm count. This is not a permanent effect. In the majority, the sperm count returns to normal when the drug is discontinued. We have a detailed video on this. You can definitely have a look at this video. Headache, in a few, it can cause headache. Very rarely, it can lead to a drop in the WBC count and a rise in the liver enzymes. Again, both these are not permanent effects. Once the drug is discontinued, these do come back to normal. Can sulfasalazine be taken in pregnancy? In ladies, sulfasalazine can be continued during pregnancy as well as lactation. In males, sulfasalazine can reduce the sperm count. As I said, this reduction in sperm count is generally reversible. So, for males, if you are taking sulfasalazine and planning pregnancy, do have a word with your rheumatologist. If you are already taking sulfasalazine and you are not able to conceive, do have a word with your rheumatologist. A sperm count can be done. If the sperm count is low, then sulfasalazine can be discontinued. If the sperm count is absolutely normal, there is no need to stop taking sulfasalazine.
Thank you, warriors, for joining me for this episode of Stand for AS videos. Let us meet again next week. Till then, keep smiling.